And hello, welcome back to the Over 40s Fitness Podcast. My name's Tristan Lowe, and today we're going to be talking about psychological and physiological responses to injury. And for those of you watching on YouTube, I hold in my hand one of my old study books as before. The reason I bring this up to today, as a trained professional personal trainer and sports massage therapist, often clients come to us with a repetitive strain injury, a work-related injury, a sports injury. It could be acute, like the one I've just got, acute injury, or chronic long-term. And with those that take up a sport, or go back to a sport, or some kind of fitness that they did when they were younger, when they're back at school. Let's say the client, male or female, they're 40 years of age. And yes, they want to lose some weight, they want to lose some body fat, they want to sleep better, feel better, eat better, move better. All those things are great, okay? And that is one of the basic fundamentals of what that all personal trainers at some point in our career will guide a client through. But sometimes we get someone that comes in that only wants to have one of those previously mentioned benefits of training, but they also want to take up running, or take up football, or take up rugby, or golf, or cricket. And often when I ask them why and when and what for, the answer is often, well, I used to do it as a kid, or I used to do it when I was at school, or a teenager, or something like that. And I'll say, well, let's wind the clocks back, John, Dave, Lisa, Karen, whoever that is. If you're 40 years plus now, and if you're a woman, you've had 1, 2, 3 children, and you go to work full time, you've raised a family, you've worked in your chosen career. But the last time that Lisa or Karen was a long distance, middle distance, long distance runner, okay, and they'll say it's something like, well, I ran around the block a few times at school. I did cross country at school in 1984 or 1991. And I have to subtly explain to them that is so long ago, there's close to zero muscle memory. If someone's in their 30s or 40s and they ran when they were a teenager at school. Okay, I did martial arts for 9 years, just close to 9 years, from the age of 11 to I think it was 19 and a half. And there's close to zero muscle memory as a martial artist now, especially training in a dynamic sport like Taekwondo. I would remember, okay, how it should look, and remember what I could actually physically achieve growing up in martial arts, but there's no way my body would be able to achieve that now as a 53-year-old. And I'm strong, fit, healthy, with quite a reasonable level of mobility, agility, proprioception, spatial awareness and balance. And even then, and the same goes for when I played basketball. I started playing basketball for fun at school, and then got into it when I grew from 5'10" to 6'4", and I played in my late 20s to my early 30s. And there's no way now. I can still remember how it should look, to some degree how it should feel, but my body would not be able to adapt to play the way that it used to. I'd still be able to dribble the ball, shoot the ball, move around the court, but I wouldn't be able to do it as well as I could, 20 years ago. And so with that admission and acceptance, I try to impart that subtly or blatantly with a client who's looking to do that. And it's quite often that a client will take up a sport, irrespective, even if we've guided them and spoke with them and said, look, okay, there's a possibility that you're predisposed to injury. However, client does what client wants outside of the appointments. I'm just going to read from my book here, my study book, and this one here is, there you go. This is the psychological response to injury. Okay, psychological response. Clients will present to us, the sports massage therapist, a wide variety of psychological states. Research has shown that there is a common response to injury, particularly conditions that restrict the client's function. The model which provides a guide to this response is known as the Kubler-Ross stress response curve. And Kubler-Ross were the scientists that came up with a modality, mechanism and acceptance of how clients respond psychologically to sports injury or work-related injury. Now there's a graph here, and it talks about, a chart, excuse me, it talks about different things that a client will actually feel, see and experience post-injury. Either that same day, the golden 24, 48 hour 72-hour rule, where if you respond in the first 72 hours post-injury, that can have a very, very good beneficial effect on how you respond for the next coming weeks and months. Now, if a client doesn't respond in the right way and go through some form of protocol 24, 48 or 72 hours after a stress injury, soft tissue, connective tissue, ligament and tendon damage, if they don't, because they don't know what to do, or they don't respond in the right way, even though they know what to do, they use what's called, I often call it like a runner's denial, or a sportsman or a sportswoman's denial. They're denying the fact they've actually got an injury, and they continue to do what got them injured. Okay, there's different levels here. We've got client esteem, we've got denial, anger, commitment, acceptance, powerlessness, and depression. And there's a degree of that everybody gets. I've had some quite hard injuries in my lifetime of sports and fitness. I've torn both quadriceps in the same year, quite a shocking injury. I've broken fingers, I've fractured fingers and toes in martial arts and basketball. I've fractured my neck on a fall. I've had knee damage or knee pain from basketball and cycling. I've had shoulder injuries, but I've had a sports hernia 4 years ago. And one of the biggest things I've learned as I've got older and as I became qualified back in 2008 was to accept that I've got an injury and do something about it at the very earliest opportunity. To give you an idea, if you fell over and you hit your face on the floor and you knock your front tooth out, you would almost certainly go straight to A&E, straight to the hospital, or go to the dentist. If it wasn't the hospital, you'd ring up the dentist at 8 o'clock the next morning, make a phone call and try and get straight in. But that is a massive amount of trauma to knock a tooth out, especially one of your front teeth. It's a trauma to your face, and of course you've got the shock of that injury. Now, if someone was to hurt their elbow playing golf, we'll call it golfer's elbow, but it could be tennis elbow, lateral or medial epicondylitis, they'll carry on playing. They'll carry on playing their chosen sport, being golf, because they like being outside. They like feeling good. They want to keep their handicap at a good level. They don't want to let their friends, their golfing buddies, down by not turning up to a game because they've got an injury. Now, if it's just a little niggle, a little bit of a sore shoulder, bit of a sore hamstring, take an Epsom salts bath, have a cold shower, maybe, if your pharmacist and more importantly your stomach will permit it, take an anti-inflammatory of some description, a non-steroid anti-inflammatory. But we're talking about someone who's got a long-term, a chronic injury that will not go away, and yet they, in the knowledge of that, they continue to do what got them the injury. Okay, now let's go back to my book. Individuals will rarely follow the progression covering each stage of the curve, but it provides a useful guide to us, the sports massage therapists, to recognise behaviour and therefore react to the client's response to injury. All right, denial, continuing with the causing activity, anger, frustration at the pain and restrictions to the client's lifestyle, powerlessness, feeling the futility of the situation, depression, pessimism about the current and the future situation, acceptance, engaging with a sports massage therapist or personal trainer or physiotherapist and the recovery plan that ensues, and finally commitment, applying all elements of post-care advice. The overall psychological reaction centres on general stresses caused by physical pain and the restriction of activity. The sympathetic nervous system dominates this and leads to soft tissue tension. Now, that's something I just want to touch on, because your muscle, your range of movement, your flexibility and mobility is controlled by the nervous system, the sympathetic nervous system. Because the sympathetic nervous system, allows you to go through a range of movement and essentially stretch a muscle as well to the point when you feel tight, before you feel a shake in the muscle area. Okay, and it's the sympathetic nervous system that takes over. It tells you that's enough stretch, or it tells you you're okay now, you're warm enough now, your nervous system switched on. It's not how soft the tissue is, it's not how much water you've drunk or how much you've slept. Yes, those things help, but it's the nervous system, the sympathetic nervous system, which enables you to do that. It enables you to take your body through ranges of movement and stretching out your hamstrings, your quadriceps, your upper back, even your neck muscles. Okay, now with that, I would always guide a client and say, look, okay, let's look at things in stages. Okay, John, we'll call him John. John, you've hurt your back playing squash or tennis. And John, on this occasion, is someone who's been playing for 10, 15, 20 years. He knows how to play the game, watches it on television, follows Wimbledon, knows the names of all the players. So essentially, this guy doesn't just play tennis, he probably lives and breathes it. He knows everything about the shoes to wear, the racket, where to go, where to play. He's had lessons as well from a tennis pro, so he knows how to, relatively serve the ball and make those, those strokes, the forearm, the backhand, the spins, all of that. Okay, great. And let's say John has a profession or a career or a job, whatever you're going to call it, where he's office bound. He's inside all day in an office or working from home or in a car. So not only does he look forward to the game of tennis, he looks forward to being outdoors if he's playing outdoors in spring, summer, and even winter. If it's indoors, on a big tennis court, a tennis court by definition is going to have some size, so it feels almost like you're outdoors. But I digress. So John's going to look forward to his game. He's got all the gear, he's got all the dough, but he's got back pain, he's got lumbar pain. It could be lumbar, it could be sacral. He just points at his lower back. So it's lower back, could even be mid-thoracic, but let's just say middle to lower back, maybe even into his glutes. And when he goes to play tennis, he gets ready, his sympathetic nervous system switches on, and it enables him to get ready from when he's packing his bag and putting his kit in, driving to the court, meeting his mates and playing. And somehow with that, because he knows how to play, he still gets through the game. And there's a level of discomfort when he's playing, okay, or maybe even once in a blue moon, a little bit of pain, but he manages it because he knows how to play the game. He knows where to stand, okay? But thereafter, that same day or the next day or a couple of days later, certainly maximum 3 days later, John's in pain. And that pain not just stops him from wanting to play tennis again, it stops him from household functions, gardening, doing something in the house, lifting something. And yet come Saturday again, Friday night, Saturday morning or Sunday, what does John do? He goes and plays tennis again because he's just feeling a little bit better. There's that 5 to 7 day window where he's taken so many anti-inflammatories, had so much rest. Now, if we could wind the clocks back and say to John, the first time that happened, you should have not necessarily just dropped the tennis racket and walked off the court, but if you could finish the game and drive home safely, what we should do the next day is spend your time hydrating, stretching, getting any supplements in your body, and seeing if you can do normal daily function, practicing that stroke. And if not, then what you need to do is book in with your physiotherapist, your sports therapist, sports massage therapist, or personal trainer. It could be a combination, or maybe even go and see your chiropractor. Whatever you choose, one person will sing the praises of one of those professions and someone else won't. Okay, what works for you may not work for someone else, depending on who you work with. But I would definitely suggest that if you do go and see a trainer or a therapist of some description, that the trainer himself or herself comes from a sporting background. They've not just passed their qualifications, read lots of books, watched lots of programs on television, and sat their exams. They come from a sporting background, because it's highly likely then not only they qualified and they've got the experience of playing a sport, it's not even got to be the same sport as you, but they know what it's like to feel injured, to get an injury, primary, secondary, tertiary injuries, all those injuries that follow the initial injury. So the point of you visiting your therapist is the fact you've done that, you've made the phone call, you've gone into the clinic or the centre. That already is a sign of acceptance. Okay, I'm hurt, I don't like this. Remember, if you knocked your front tooth out and you fell over, you'd go to A&E the same day, especially if there was trauma, bleeding. At the very least, you'd book into the dental surgeon on an emergency appointment, and you would pay whatever it cost to get in there, because that trauma has come on in the space of 1 second. It only takes a second to fall over and knock your front teeth out, all right? But with injuries through sports, sometimes they can creep up and come on slowly, and they're probably the worst ones as well, because it's hard to identify exactly when, how, and where you did it. Whereas if it's something that comes on over a space of time, you can't pinpoint. All you can say is, I think I got it in this month or this year. It's probably better to break a little finger, okay, and know that you've broken it straight away, when you get it scanned, and then it's set and fixed straight away. Yeah, I broke my wrist about 8-9 years ago, plyometric jumping, still thinking I had it in basketball. Broke my wrist, took 1 second to break it, my left wrist, it took an hour at the hospital to set it, and then go back again 3 days later to have the new cast put on it. And then of course, then the 6 weeks in a plaster cast. Then after that, I probably spent up to 3 months rebuilding up the strength. But I know exactly when I did it and how I did it, and I've come back to near full strength. I can throw a jab now, I can do press ups, such a long time ago. All right, now, what we give is support to our clients, and support comes in this, guys, in this particular order. A clear justification for a recovery plan, a clear identification of lifestyle positives and negatives for the client, positive communication, listening skills, okay, SMART goals, relevant exercise prescription, prompts, motivation, feedback, and effective testing for return to function. And all of those points are important to remember. And there's one element that often comes into most sports-related injuries, work-related injuries, and that is a degree of strength. No one wants to recover from their injury weaker. At every point, whether going through the support for the client, or let's go back to the client's responses, anger, depression, acceptance, denial, powerlessness. Those things can vary depending on the client, the severity of them, or whether they've got them all or one or the other. But one thing that goes through, we want to come back just as strong, and if not even stronger. Now, there's no guarantee on that, irrespective of where you go and who you see. But there's one thing, and that is a client doesn't want to come back from an injury weaker. So the first thing we do is we say to them, okay, you're injured. The fact you're sat in front of me here in the consultation room, let's do something about it. Now, I would then guide a client to perhaps even take the measures of hiding or putting their equipment away. If you've got a set of golf clubs, you've got a set of tennis gear, pack them up and put them away. Put them out of sight. And that is something people don't want to do. Hide your tennis shoes, put your golf shoes away. Yeah, out of sight, out of mind. And I mean properly. Wrap them up, put them in a bag, and stick them in your shed or your garage where you can't actually see them, because that actually can help. I had a client only recently ask me what she could do in replacement of a running injury, and my response is stop running, okay, recover, repair, take up the correct strength training, strengthen your body to go back to running, okay? There's no rush, yeah? You're not being paid to run around the block or run across the field, Even professional athletes who are being paid, the famous ones, the wealthy ones, they're being paid even whilst they're going through rehab. You're not a multi-millionaire professional athlete, okay? Most people aren't. 99.9% of the people on the planet are not multi-millionaire professional athletes with access to the best treatments that money could buy 24/7 around the clock. And even those people, sometimes their careers are curtailed early, or they stop or they get downgraded to a lower league. Okay, everybody knows that. Everyone knows their favourite sports star or athlete, things like football and basketball and rugby, where they're not the big name anymore, but they've earned their money at the top in their age bracket, could be between 18 and mid-30s. So treat your body, okay, like you would treat your car. You get it serviced, you get it MOT'd, you put the right fuel in it, you know when to stop it. If there's something wrong with your car, and it starts breaking down, you take it to the chop shop, you take it to the car dealership, or even the Menders, the independents, and you get it sorted. And you don't get back in that car until they've sorted it and handed it back to you. Your body is infinitely worth more than your car, so treat it as such. Okay, that's it for today. All I would say is, stay healthy, stay fit, look after your injuries, accept you've got an injury, okay, and try not to get too depressed. Be optimistic about it. Contact myself, contact one of my colleagues, one of my therapists, or contact your own therapist wherever you are in the UK or overseas, and nurse yourself back with their professional help to back to your sport. Okay, that's it. That's today's podcast. My name's Tristan Lowe. We're called the Over 40s Fitness Podcast, and we're on YouTube, Spotify, Amazon Music and Apple Podcast. Yeah, feel free to subscribe to the channel, like and comment. I built the channel just to put out content, not to become rich and famous. I'm simply doing what I do in my line of work inside my own private centre. The difference is I'm now doing it as well on YouTube. So for those of you who follow my channel, you're getting free experience and advice. All right. Thanks for watching. Thanks for listening. See you next time. Bye for now.